or the radial side, it's depending on what is your target is. So you're gonna stabilize the proximal side of it and then hold down to the ulna, and then you can try to pull it. Or you can try the distraction by having their ulna on the shoulder, and then you're gonna go close to hold it and then pull it. So depending on the direction, like humerus is here and then the ulna is cupping, right? So you can check it like that way or like a distract way, this way, right? But there's a pros and cons. When you are checking like this way, sometimes their olecranon, it's kind of cupping into the olecranon fossa of the humerus, so you may feel that first before you actually feel something else. But like if you are checking like this way, so then you need to be careful to check the sensation of the elbow, not the shoulder, because shoulder is coming down together too with that motion. So your sensation should focusing on the elbow more, right? So there is a pros and cons depending on which position you prefer to do so. And then you can check the medial and the lateral glide too. So you can kind of go close to. So now I'm going the lateral glide. So again, my force is not going like this way. One side is stabilizing because I'm gonna push the ulna and radius together to lateral, right? So my force is not going this way, right? So you are checking the lateral glide or the medial glide of the hand, like that, elbows, right? Like this way, right? Or you can check the gapping. So when you are checking the gapping too, you are not doing it in the fully extended forearm because it's kind of close packed position now, right? So then you're gonna unlock and then slight push. It's the same thing. You are not pushing it like together. This one is stabilizing, pushing this. If you do this, it's hard for you to feel it actually. So you're gonna do this or the lateral gapping to feel the difference between the affected and unaffected side, right? That's for the elbow. And then if your patient had the issue specifically for the radial humerus joint, so then you can try to do the anterior and posterior glide of the radius on the humerus. So you're gonna hold down to the radius and then you can try to go anteriorly and then the posteriorly. So then now you are stabilizing the ulna more here to actually feel the movement. So those two doesn't go together to anterior and
So
posterior
his
side.
arm should be on that position.
Yeah, like
close
the
to
relaxed position would be better than like
Okay.
the full extension. You can actually do that too, but like a body wise, like he is kind of out of the way, right? So then I need to stabilize with something
it's
else,
better,
right?
like,
So
close to
if
90.
you can place your patient hand on the table like this, so then you can actually try the posterior and lateral glide and then stabilizing here to actually feel it like that too. On this position, it's easier for me to do like that way.
We don't need to do all of them, right? Just pick how many.
Depending on your patient complaints, right? If your patients are complaining about more of the flexion, then you need to definitely check the anterior glide of the radius, right? But like more would be better than less, right? So if you could do it and you do have time for that, so then you can kind of try to see all those ranges, okay? And then, so shoulder rhythmic stabilization. So that's the technique that you can use for the frozen shoulder. And usually your patient has the issue with the external rotation, abduction, and then the internal rotation, right? So you are encouraging your patient to achieve the full range back. So while you are having your patient issue with, let's say your patient has like this much kind of the range, right? So then you're gonna get to the point where your patient doesn't feel the pain but full range, right? And then you're gonna explain your patient that I want you to, Scott?
Yeah.
So I want you to against this finger to put your hand rotate there, and then this finger to bring your arm away, so abduction motion at the same time together. And then the other action, the combined, is gonna be the pushing into my thumb and then thumb on that side together, okay? You ready?
Okay.
So you're gonna reach to that point first, and then can I get you to push into my finger together? Yeah, this one too. Okay. and then right away push into my finger here. So 7, 6, 5, 4, 3, 2, 1, and relax. And then you're gonna take up the slack, and then do it again 3-4 times more, further and further, till you are reaching on this kind of the full range, right? That's the rhythmic stabilization. So
So it's just like a PNF.
yeah, it's PNF technique, just so they have the different name. And then
Without
it's
the actual stretch.
yeah, pair of the movement going on together, not only one direction, kind of the way to stretch it. And then your target is like external rotation and abduction together, and internal rotation and adduction together. And then you need to distract the shoulder joint a little bit while you're holding it. So one of my hand here is holding the wrist to against the external rotation and internal rotation here, and the other hand is gonna be holding the humerus to against the abduction and adduction motion. And then there is a little bit of the distraction of the shoulder joint happening together. So you are pretty much busy.
So you sort of like
So your goal is like this way. So rhythmic
What's different in
stabilization.
hold and relax? It's similar one.
It's similar that somebody like invent some technique they wanna name it, right? So it's rhythmic stabilization is the PNF technique with the combined motion, but it's a hold and relax technique kind of the style. And usually hold and relax technique doesn't have the combined motion. Usually you are targeting just to the one muscle at a time kind of the style, not just like this way. Any other questions?